Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're so glad that you've joined us here again today. I am very pleased to have with us Dr. Helen Goodwin, Senior Staff Specialist Paediatrician and Clinical Lead of the Paediatric Patient Safety Program. Hello, nice to see you.
Thank you,
Dr. Helen.
Hello.
And we have also Paul Hunstead, Improvement Lead of the Paediatric Patient Safety Program as well at the Clinical Excellence Commission. Thank you, Paul, for joining us.
Thanks for having us.
Paul and Dr. Goodwin are joining us to talk about an important health issue and health matter for us to be able to find out more about it, and that is sepsis. It is World Sepsis Week, so we're focusing on this topic today. So thank you for joining us. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to Aboriginal colleagues and community members who are joining this session. We also pay respects to multicultural communities and refugee communities who have joined us in this forum today. We are joining from the land of the Camaragal people of the Eora Nation. Now, I'd like to ask you, as we always ask you, to please keep your microphones on mute, but keep those fingers active. We want you to ask your questions on the chat. It's not every day we do have specialists here online to talk about sepsis. So please keep those questions coming in. But now we'd like to invite Dr. Goodwin and Paul to talk about sepsis and give us an example, or can you explain to us why sepsis is such a serious issue?
Well, sepsis internationally, 1 in 5 deaths is related to sepsis. So 11 million people die every year in the world, and 20% of those, or 1 in every 5, die from sepsis. In Australia, we see approximately 8,700 deaths per year from sepsis. And it's the number 1 causes of death in hospital. So it's a significant problem.
Yeah, and there have been some cases, and that's why it's something that we should be taking into consideration.
Yes. So this is World Sepsis Week this week, where we talk about sepsis and try and raise the importance of sepsis in the community and ask people to ask, could it be sepsis when they're very sick or unwell and present to hospital or see their doctors? And yes, there has been an increase in cases recently of sepsis in the community compared with before. But that always happens every year. And this is really a week when we try to raise the profile of sepsis to make people ask, could this be sepsis when they're unwell?
Paul, could you tell us what exactly is sepsis and how do you get it? Can you catch it from others?
We don't catch it from others. Sepsis is, I guess, when the body has a really extreme reaction to an infection, and it actually starts to injure your own organs or your tissues. So it can be caused by a bacteria or a fungal infection or a viral infection as well. And it's really important that it always starts with one of those. So it starts with an infection. It can, in fact, be life-threatening if it's not managed quickly, and can lead to septic shock or organ failure and even death, which is why it's so incredibly important to get onto it quickly, to recognise the signs and the symptoms, see your doctor, and always ask them the question, could it be sepsis?
Signs and symptoms. And for those online, we will be putting some links on the chat, and you've seen these PowerPoint presentations and slides. What are the symptoms that we have that people should be watching out for? Especially for kids, or for babies and children, I guess. Helen and Paul.
So for babies in particular, just knowing that your baby's not quite right. So parents concerned that the baby's sick and seems to be getting sicker, then that would be something that would make you worried that, could this be an overwhelming infection, which is what we mean by sepsis. So in little babies, being floppy or pale or having problems with their breathing, breathing fast or making funny noises when they breathe, like a noise when they're breathing. In looking at the circulation, so if they're very pale or blue discoloration, particularly around the lips, or pale limbs, very red, like you might have a severe rash, like sunburn, can be a sign of an overwhelming infection, as can be the rash that you see that people describe with meningococcal sepsis, which is like bruises on the body, big dark red spots that don't go away when you push them. And then looking at more generally a change in behaviour or new confusion, very tired, not really waking up, not able to smile, just not flat, lethargic, just not themselves. And then an unusual cry or or irritability that seems to be excessive, and change in confusion, and older people, it can be a new onset of just being confused or a bit doddery, vomiting, diarrhea, just not themselves. And most people who've had sepsis said that they felt sicker than they've ever felt in their life, and often complain of severe total body pain for no obvious reason. So they're the kinds of things that I guess would make you worry that potentially it could be sepsis.
Yes, and Paul, we've learned how serious sepsis is, and we've seen the signs here. We have the links, and it's really interesting when you said you've never felt sicker. This could be, and that this could be sepsis, and that's interesting because a lot of people feel sick, but you never know until you really feel almost,
And often, we think we feel terrible, and then, you feel worse the next day, and you think, oh, actually, yesterday I wasn't as bad as I thought. It's a difficult one. It's very hard to pick. It starts with an infection, so you're sick from having an infection, but sepsis is that next step of overwhelming infection or overwhelming the body's response to the infection is severe, that can cause problems with your kidneys or your breathing and not passing urine, being confused. All of those things are a sign that it's something more than just an infection.
Yes, and Paul, so what are these signs? I mean, you said all these things, but what is it that you should be looking for? Because it could be mistaken for other sickness, right? And you did say in that slide, one of the slides, you said that not all of them could be at the same time. It could be a few in one time. And
absolutely. So what we also know is that significant bacterial infection, which is often the trigger for sepsis, can occur after a virus, and commonly, particularly influenza. And so it's really important that people get vaccinated against influenza, but particularly after a viral illness, you can get a secondary bacterial infection and then present very unwell. So it can be hard. And that's why we ask people to ask, could this be sepsis, if they're feeling really sick and worse than they've felt before, and show any of those signs that we talked about.
Now, I know we're talking about children, but with adults and children, are they the same symptoms? Do we find that is the same?
It's a good question. I mean, if I go back a step, it's interesting. Only a quarter of Australians are aware of some of the signs and symptoms of sepsis. So 1 in 4 adults actually know what to look out for. And the signs can be actually quite tricky because often the signs are quite subtle, and the signs are often similar to a common virus, a common cold. I guess the difference is, as Helen pointed out, is that often you get better after you have a virus. But with sepsis, you often feel like, as Helen said, you feel like you actually can't get out of bed, you can't walk, you can't talk, and you feel, sometimes people have said, I just feel like I'm going to die.
It does sound really serious. I mean, if you were a parent, and the child, you see this, the symptoms, what should a parent be looking out for? Because with an adult, you can actually know it, but when the child is feeling this sick, what is it that the signs that you should be watching out for?
So if a child, for example, has a fever and they have some Panadol and they're back playing with their toys, or, pushing their smiling, interacting, being their normal self, it's probably not sepsis. If the child has a fever though, and they just don't get better no matter what you do. They're not drinking well. They're just really lethargic and sleepy. You know, they're not interested in you or their surroundings. If you do things to them, they don't get upset. So, I mean, we always worry if a child comes to hospital and we, you know, do a blood test on them or something and they don't really cry, that's a really big red flag for us. But what we also know is that parents are very good at picking up when their child's getting worse. So there's been really interesting research looking at children presenting to hospital and children in hospital that shows that parents who are worried that their child's getting sicker are usually right. So while I mean, there's a big study done in Melbourne where they've asked 100,000 times to parents, are you worried your child's getting worse? 1 in 25 said yes. So that's a lot. So it can be hard to pick the one that's really worse. But of those people who said their child's getting worse, they're 9 times more likely to get very sick and end up in intensive care. So even though that's a very small number of people, parents are very good at knowing if their child's getting sicker. So if you're worried that their child's very unwell and they're getting worse, even if you've seen the doctor and they've reassured you, if you go away and think, no, they're getting sicker, please come back. Please go back. Please go and see somebody and say, I'm worried my child's getting worse. Could this be sepsis? And if it's not sepsis and it turns out the child's got a virus or they're just okay, then be reassured. That's great. But come back again if they get worse again. Don't be afraid to come back. That's our job. And don't be afraid to ask the question, could this be sepsis? Because that way it brings it up in everyone's thoughts to ask that question.
And one thing I would say is trust your gut. As a parent, trust your gut. You know your kids better than anyone, as Helen pointed out. But also, if it's your loved one, if it's your husband, your mother, your father, you often know them better than they know themselves sometimes. And often it's really difficult to communicate how you're feeling when you're really unwell. So I think it's really important to trust your gut if you're really worried. And I know in that slide before there are a few specific signs and symptoms of or things that you would be concerned about in a child. But one thing I think is important to say is sepsis is rare. But the challenge is, as I said before, some of those signs and symptoms can be quite similar to common viruses at the beginning, which is why it makes it quite tricky. So things as you can see on the screen, things like breathlessness. If they feel really hot to touch, they might have a fever, for example. Things like seizures are a concern. Absolutely. If your child is really difficult to wake up, some kids are really quite floppy when they're being held. That's a really concerning sign and would be a sign that you need to take them to an emergency department. But just, they're not themselves. You see a change in their behaviour. That's when you need to really start to worry.
And if you have any questions, please let us know. We also have some links on the chat. We have a question from Sonam. Would you call it sepsis if your child's flu progresses to pneumonia?
Not necessarily. So sepsis by definition causes organ dysfunction. So heart's not working very well, or your blood pressure drops, or your kidneys aren't working very well. So if you just have a secondary bacterial infection, but your body's quite okay to fight that infection, and the child's still, able to eat and drink and do things, then that's not sepsis, that's pneumonia. Yes, pneumonia can lead to sepsis, and that's why it's hard. Because sepsis is like an overwhelming total body response to infection rather than just an infection in a particular spot. So they can be really hard, and we don't expect people in the community to be able to tell the difference. Certainly if if your child has a chest infection or a pneumonia, they might still be able to eat and drink. Their kidneys might be working normally, their blood pressure's okay, their heart rate's okay, they've got a fever, but they're not terribly unwell, then they need antibiotics. And usually they get better. But if they get floppy and lethargic and can't breathe and need oxygen and just not themselves, then that's when you start asking, could this be sepsis?
Now, the question here is, you say that if you're really unwell, what do you do? Do you call 000 first? Or when do you know when to just call Health Direct to ask advice? Or when do you go to your GP? And so I guess that's
be a hard one. So sometimes we get it right, and sometimes we get it wrong. So if you're really worried that someone in your family is terribly unwell, then by all means call 000. If you think that's a life-threatening emergency, then call 000. If you're not sure and they're sitting up chatting and but not quite as well, or you think, oh yeah, they'll be okay if we put, they can walk, they can get up, they can get to the toilet, they can eat and drink, then you could ring your GP. And the other thing you can always do is ring the telephone interpreter service if English isn't your first language, and call the helplines and ask where, what should I do or where should I go?
Yeah, so that's 131-450 to call TIS line, and then call Health Direct, and where a nurse and a health professional will be answering the question. It sounds so scary. I mean, for parents and for individuals to know when they feel so unwell. Are there medications that you should be taking that could be should be in your drawer for you to do this? I mean, I'm just
not really.
No.
No, if you only take the medication that's been prescribed for you. If you genuinely have sepsis, you'll be admitted to hospital, intravenous access with a drip would be put in, you'd be given intravenous fluids, intravenous antibiotics, and, sometimes need support for your blood pressure and things, and sometimes end up in intensive care. So that's not something that you can treat at home. Sepsis isn't something you can treat at home. If you have a viral illness and you're a bit off colour and you take some Panadol or Nurofen and you feel a bit better, that's fine. You can do that at home. We wouldn't recommend people having a stash of antibiotics at home and just taking them, because you don't really know what you're treating. You might be on the wrong antibiotic. It might just make you sicker. And then it confuses the whole issue. So simple medications at home, completely reasonable. If you need to have more intensive kind of treatment, you should be in hospital.
My question is, a lot of people from multicultural, culturally and linguistically diverse communities may be traveling overseas and coming back and then feeling very unwell, or if you're traveling and you're unwell, what should you be preparing for when you suspect maybe you have sepsis or you've been treated for sepsis? Can you travel? Can you do other things?
If you've got genuine sepsis, you're too sick to get out of bed, so you're not really well enough to get on an aeroplane. We would suggest, though, that before anyone plans a big trip, they see their GP, see their local doctor, and get them up to date with all the immunisations for diseases that are preventable. Make sure you're up to date with your COVID vaccine, your flu vaccine, because you're still more likely to get an overwhelming secondary infection if you have a viral illness. And obviously you can also get sepsis from those kind of infections. Make sure you keep up to date with all the regular medications that your GP prescribes and that you need, and find out what immunisations you might need to go to a particular place. Please don't get on an aeroplane if you've already got a very high fever or you're very unwell, because obviously you can't access emergency care in the air. It'd be better to get sorted first.
Paul, just a question about, where you get this. I know that during COVID, one of the things that we found, that being isolated when we were in lockdown, that we were being separated from each other. If you're unwell, you stay home. Is it recommended that we still practice all these safety measures that we've learned throughout COVID?
Yeah, absolutely. We learned some great skills during the pandemic, during COVID-19. Things like hand washing, etiquette. If you feel like you're going to sneeze or cough, you do it into your elbow. And also, if you're unwell and you do have a fever, don't come to work, don't see your friends, stay at home and isolate. But the things like hand washing, we became so good at hand washing. But I think some of those things have started to fall off a little bit. But just, you were mentioning some of the other things that I guess we can do it at home. We all can do at home to try and reduce the risk of sepsis. And there's simple things like, as I said, hand washing. If you've got an infection, or if you've got a cut or graze on your skin, absolutely cover it up, treat it. And if it does become red or swollen or painful, go and see your GP, or again, call Health Direct. But there's a number of things we can do. Simple things like, stick to your regular regime of medications if you're on a number of medications.
Could you, if you've been treated with sepsis and you got better, could you have it again? Is it something that could be something you could be worried of? experiencing again? Because I feel like this could be it could really drain you.
Unfortunately, if anybody is at risk of sepsis, and even if you've had it before, you're at risk of sepsis from a different organism at a later date. That's definitely something that we do know it can happen again. There is particular groups that are higher risk than other groups, particularly young children, babies, children particularly under 3 months, women who've given birth in the last 6 weeks, elderly people, immunocompromised people, so they're people who've got underlying conditions that suppress their immune system, cancers, a lot of the cancer treatments, things like that. And we do know Aboriginal and Torres Strait Islander people are at a higher risk of developing sepsis in response to an infection. And we also know that, unfortunately, people from linguistically diverse or multicultural backgrounds are not necessarily more at risk of becoming unwell with sepsis, but they're often more at risk of not seeking the attention or going to hospital early. And so we encourage people that if you're feeling really unwell, that you do get checked out. And don't be reassured if someone says you're okay, you'll be fine. If you're worse, just go back and ask them, am I still okay? Because we know that that's a risk factor. But yes, there's definitely people who are more at risk.
Now the infections, can we just run through the infections that this could start with? It seems like there are the bacteria and the viruses and infections that could be the start of a serious sepsis health matter.
Yes, so it can affect any of our organs or tissues. So, for example, your lungs, it could start with a pneumonia and develop into sepsis. It may start with a sore throat, for example. Again, that could develop into sepsis. And you can see up on the slide at the moment, your organs. I've talked about the lungs and the kidneys and the throat. But absolutely your digestive system. So you could have a gut infection that develops into sepsis. Brain, you may have all be familiar with the term meningitis as well, could develop into sepsis. And your skin, I've already mentioned, cuts, grazes, bruises can then develop into sepsis. But one thing I do want to make quite clear is sepsis is rare. We don't want to scare people about sepsis. And if you get onto the signs of sepsis early, and seek medical attention early, whether it's your GP or an emergency department, you're on the right track.
Why is it important for people to know the signs? Just because it is serious. It seems like it could, as I said, I just listening to the signs, I'm already drained. I feel like it could be upsetting. And you said that if you're together, this is when you can, if you're very close together, people living together with this is when it could spread.
Yeah, so everyone not everybody, but a lot of people would be familiar with meningococcal disease. It's well recognised. It's a cause of sepsis where people become very unwell very quickly and get overwhelming infection. So there's other organisms besides that that can do a similar thing. They present slightly different, but same idea. They cause overwhelming rapid infection. It's quite rare, but we know that people who are close contacts of someone with one of those severe infections like meningococcal disease or invasive streptococcal illnesses, they are more likely to catch it. And so if someone in your family or someone who's close to you is affected by sepsis or infected with one of these or bacteria that can make you so unwell, then the public health unit will help to look after you and make sure that those people get antibiotics to prevent them getting it. So, for example, if there's a 16-year-old in a house that gets meningococcal sepsis and meningitis, then public health will make sure that all of the people that are in their household are given antibiotics to prevent it. So while we say isolate from other people when you're unwell, if you're a close contact of someone with a very severe infection, the public health unit would be in contact with you to help protect you.
That's really important. I guess I also wanted to just ask you the process, because a lot of people online, and especially since we have multicultural media online here, it's the process. When you call emergency and you have sepsis, you could be diagnosed with sepsis. What will happen is they'll take you to the hospital. And like you said, the public health unit will be in touch with the family.
Yeah. So if you have a a simple infection that needs antibiotics, but you're well enough to go home, that's not sepsis. Okay. So sepsis is when it's an overwhelming infection, really sick, have to stay in hospital. Then the public health unit, yes, would contact the people around that person and make sure that they have appropriate antibiotics so that they don't catch it themselves.
And that is language support when
Correct.
needed.
Yeah.
Yeah, that's great.
One thing we really would love people to do is to use that language. Could it be sepsis? So if you are with your loved one in hospital, whether it's your child, and you really are worried, ask the doctor, ask the nurse, could it be sepsis? Because it puts the idea in their head, and then it's something that they actively need to rule out.
And as you said, it's quite rare. So that question of could it be sepsis might be, and it is about educating everyone that if you really feel so bad, it could be,
Absolutely ask the question. We know that if we're, really sick and we're losing weight or doing something else that, if you're coughing up blood or had some other symptoms that weren't right, you would say to the doctor, could this be cancer? Like that's what we're talking, it's rare. Okay. Same idea. If you're really sick, you've got a terrible infection, you're getting worse. We just want you to say, could this be sepsis? So they can then say to you, no, it's not because we've checked this, and they're all okay. You've got pneumonia or you've got an infection. We're treating it with this, but it's not sepsis. Or, oh, good point. Let's just keep a closer eye on you just in case. That's the message that we want to get out, because it's not something that's really common. Yeah. But we just want to raise people's awareness, because we don't want people to think, oh, if only I'd thought to ask. I thought of it. I should have just said it. I should have asked, in the same way that we're worried if we lose weight or whatever. Not that that happens very often, but that, we ask the doctor, could this be cancer? Same idea. Could this be sepsis? Just think to ask the question.
Yeah, and that's right. With there's a lot of health issues and health matters that we hear, but sepsis is not one you hear every day. And so if this has come up, you probably in some communities, in multicultural communities back home, this might be something that they've never even heard about.
Absolutely. It's not something, and that's what this whole World Sepsis Week every week is about, raising that profile and getting people to think of it, and just understanding that it's a body's serious, overwhelming reaction to an infection is what we mean by sepsis.
There's a question from Sonam again. How quickly can sepsis progress, and if bushfire affect its prevalence or severity?
Yeah, it's a good question. So I think one thing to be really clear about is if for example, Helen has sepsis right now, she wouldn't be in here. She should be in hospital. But if Helen did have sepsis, I'm not at risk of catching sepsis from her. Remember, sepsis starts with an infection, whether it's a virus, bacteria, or a fungal infection, but it's that infection that then develops and becomes, as a viewer said, like a bushfire. It becomes out of control very, very quickly. And we still don't know why some individuals may have the same virus or bacteria, but some might go on to develop sepsis and the others may not.
But that really is a good question. What you explained right now, it's not like if I sit next to you, you're going to get it. It's an internal matter.
We may share the same virus. For example, if Helen had a virus that caused pneumonia that then developed into sepsis, I might get that virus and be unwell for a couple of days, but I won't definitely go on to develop sepsis. Absolutely not.
Just we've run out of time, and that's gone fast. Yeah, that's gone fast. But it's really, I really learned so much, and I think that question of could it be sepsis, could it be cancer, like you said, could it be sepsis, being so rare, it's been a really eye opener for me, and I hope it has been for you too. But if there's any last words for the health workers who are listening to the multicultural media, what is it that the key message that you'd like them to be able to share with their communities? Paul.
I think probably there's two things from me, and we've said them already. The first is trust your gut, whether you're unwell yourself. Again, often it feels like it's the worst infection that you've ever had. Trust your gut. If you feel like your child or your loved one has never behaved or been this unwell before. And the other thing I was going to say is, again, mention those words. Could it be sepsis? It really plants a seed in our clinicians' minds about really taking them seriously.
Thank you, Paul, and Dr. Goodwin.
Thanks very much.
Any
immunisation. don't forget your flu vax, don't forget your COVID vax, don't forget to immunise your children, because the preventable disease that children are immunised against are the ones that cause sepsis. So get their pneumovax, go and get their routine scheduled immunisations, because they do save lives. That's the first message. As Paul said, if you think your child's getting sicker and sicker and sicker, then just turn up and say, I'm really worried, could this be sepsis? They'd be my two messages.
Thank you so much. Thank you, Paul, and thank you so much, Helen, for being with us today. And I hope you learned so much. That question of could it be sepsis is such a crucial, just one-liner question. And when you see your family, if they are sick, but it is World Sepsis Week. Please share that information with your communities, with your family, and with your colleagues and friends. Thank you so much for joining us. Please join us again in the next fortnight, where we will be talking about World Mental Health Month. But for now, stay safe, and remember to wash your hands and keep safe, and stay indoors and stay away from the heat. Take care.